This is Becky from More Than Borderline, and today I'm talking about how ministers can help people with mental illness. An author by the name of Howard J. Kleinbell wrote a paper called The Mental Health Ministry of the Local Church. This paper is featured at www.religion-online.org. Kleinbell writes, "The clergyman has a responsibility to both the ill person and his family." He identifies the responsibilities to the ill person as recognizing the problem as mental illness without attempting to diagnose it, aiding the person in finding psychiatric help, or if the person is unwilling and unable, aid the family in making an involuntary commitment, providing a supportive pastoral relationship during treatment, whether it is hospitalization or outpatient, and maintaining a close relationship and offering pastoral counseling during the post-treatment days, but without fostering a dependency. Kleinbell writes, "The minister has major opportunity in helping the patient's family. Often they are living under a dark, miasmic cloud of fear, humiliation, and guilt. Except for a minimum of help from the social work department of a mental hospital or clinic, the family is left to handle the trauma largely on its own. The pastor's opportunity to stand with the family in their lonely, confused distress is one of the privileges of being a clergyman." He identifies the clergyman's responsibility to the family as helping them accept the fact that their loved one is mentally ill. He writes, "Family members sometimes deny that their loved one is really mentally ill, holding on desperately to the hope that the person will snap out of it or that all he needs is a good rest. Their own feelings of distress, social stigma, fear, and guilt may be too strong for them to take appropriate steps without firm support and guidance by a trusted clergyman. Another responsibility is to assist the person in getting psychiatric help, or assist them in getting the person help. Another item is supporting them to help them understand and learn through the crisis. Another, helping them relate positively and prepare for the person's return in cases of hospitalization. Counseling the family in cases requiring permanent custodial care. Keeping close contact during post-treatment adjustment, and mobilizing a caring ministry in the congregation." Ministers have the opportunity to help, and should definitely do so, because spirituality is part of who we are, and it largely impacts how we feel about ourselves and our diagnosis.